Hello friends, welcome to my channel Dr. Online 24/7. Today's topic is typhoid fever. What is typhoid fever? It's a serious infection caused by the bacterium Salmonella enterica serotype typhi. This nasty bug spreads through contaminated food and water. It's more common in places with poor sanitation, so stay safe and keep your surroundings clean. Remember, knowledge is power. Protect yourself and others. Did you know typhoid symptoms can show up 6 to 30 days after exposure? It often starts with a high fever reaching up to 104 degrees. You might feel a pounding headache and overwhelming fatigue. Abdominal pain and loss of appetite are common too. Some people experience constipation or diarrhea. It varies. Look out for rose-colored spots on your chest or abdomen. In severe cases, confusion or intestinal bleeding can occur. Stay informed and seek help if you notice these signs. Causes of typhoid. It spread through contaminated food or water, mainly through the fecal-oral route. Poor hand hygiene, especially after using the toilet, can also lead to transmission. And don't forget about carriers, people who recover but still shed bacteria in their stools. Stay informed and practice good hygiene to protect yourself and others. So you think typhoid is just a thing of the past? Think again. Here's how we treat it today. First up, antibiotics are the mainstay. Ciprofloxacin, azithromycin, and ceftriaxone. But remember, the choice depends on local resistance patterns. Supportive care is crucial, too. Stay hydrated, eat well, and get plenty of rest. Fever. Acetaminophen is your friend. Severe cases might need hospitalization. Don't take chances. Now let's talk prevention. Drink clean water and eat properly cooked food. Wash your hands thoroughly and consider getting vaccinated before traveling. Stay safe out there. Typhoid is no joke. That's it for today. Hope you like it. Thanks for watching Dr. Online 24/7 by Dr. Sanabawani. Don't forget to like, share and subscribe my channel.